we've developed some draft recommendations that for future emergencies, and we want to go through the recommendations with you today and get your feedback on them to, well, basically to sense check them to see whether you agree with them and whether they make sense to you. Chris is in charge of the slides because I get kicked out periodically and it's happening a lot today. So if I disappear, it's not because I'm not interested, it's because I've got no internet. So our first set of recommendations are around guidance during emergencies. Can you move the next ones on, Chris? So what the research that we've been doing is suggesting very strongly that we need some clear and consistent guidance. So the Department of Health and Social Care and the Department for Education should provide clear and consistent guidance about delivery of health, education and social care to commissioners and service providers in a future emergency. And any changes from previous guidance should be clearly highlighted. Our second recommendation is that health, education and social care services should provide clear information about changes to services and consistent guidance about any reduced emergency local offer, and any changes from previous guidance should be clearly highlighted. Do they make sense to you? You can put your thumbs up, you can put in the chat, or if you've got anything that you want to say about either of those recommendations. Yep, great. Okay, oh, gone too far. Okay, so our next set of recommendations regarding emergency guidance is any reduced local emergency offer to disabled children should be stipulated in guidance to both families and professionals. And all guidance regarding children and young people should include specific guidance for disabled children. Education settings should be kept open wherever possible for disabled children. Feedback? Yep, brilliant. Oh, we're cracking on here today. Next one, Chris. Thank you. So impact assessments of proposed changes to service provision and business continuity plans should be agreed across sectors, so health, social care, education. And a family hub or other designated site should be a specific contact for health, education and social care services. And they should provide support for new and existing families of disabled children who require advice and or provision. Yep. Next one. There should be clear lines of communication between professionals providing care and managers, and then upwards to goal command on the impacts of service changes during an emergency. And the needs of new families and new problems for existing families should be triaged by universal providers, for example, health visitors and early years services. Making sense? Yep. Okay. Commissioning in emergencies. This is part 2. Assessment and diagnosis of new problems for new families and new problems for existing families should be prioritised. Health and safeguarding risk assessment of all identified disabled children and families should be undertaken across sectors and reviewed regularly. So that's our RAG rating, should be done regularly during emergencies, done across sectors. And there should be a designated lead for disabled children's health and care provision in each area. They should be visible and easily contactable through family hubs or a similar service. Yep, making sense? Oh.
Just wondered whether, rather than get through all 33, we're really keen to hear what you think. We're really keen to hear what you think. And we don't really know who you are, whether you're commissioners or providers. So if anyone wants to just be brave and tell us who you are and whether this is making sense to you. Are you surprised that the government should be giving us clear, consistent guidance? Or... Alex, as we can see, we know you can speak because we heard.
Yeah, I'm just trying to. I mean, it makes sense what you're saying. I just, obviously we were reflecting on what's happened over the last few years, and it felt at the beginning that we didn't have a lot of guidance, did we? And things were springing up in different areas, just depending on personnel, really, and keen people. So I guess it would help. It certainly would help to have guidance. And the thing you're saying seems sensible. I don't know. I'm just wondering where it goes. There's many more questions around what you're doing, but I would like to hear the rest of what you've got to say, and then we'll get the context around maybe what happens. And
are you a commissioner?
Yeah. Or... No, I'm a designated clinical officer. So and I was actually involved in a sort of a triage huddle hub thing in that time with my health and social care colleagues to do with Zen. So that we just sort of decided to do ourselves because we needed to. So it's interesting to hear what you've got to say. And I think certainly our colleagues in providers would have welcomed a little bit more guidance at the time. Personally, yeah.
Hi, Louise.
Sorry, I'm not a commissioner. Sorry.
No, that's right. What's your background, Louise, in profession?
Hi. So I'm working in Hertfordshire. I am working with children's therapy services and the education service to kind of work with families going through EHCP and tribunal appeals. Interestingly for me, I was part of the kind of ICO Silver Command bit during COVID. So I was getting lots and lots of emails all the time with guidance on absolutely everything to do with health. But you're right, there really wasn't much guidance there for what happened for children with education, health and care plans, children with additional needs. So I think it's really good and really valuable to highlight that that's needed. I think that would have really helped get a consistent approach and for people to feel assured. Interestingly, you've picked up there about the assessment and diagnosis for new families with new problems. I'm not sure from my experience that was always picked up as a priority. I think there was sometimes a focus on the existing families and we had a duty of care to them. So how could we support them rather than kind of new families coming in? So that's interesting for me. I don't disagree with it. I think it just challenges the thinking that we had at the time.
Yeah, no, that's right. Well, that's reassuring. Joan, did you want to come in?
I feel like I need to put my hand up and say I am a commissioner. It would be really interesting to hear the rest of them, because everything you've said so far makes sense, and some of the stuff we were doing locally in Devon. And I guess I've got other thoughts about kind of information sharing and dissemination of information, and also how that the designated lead that you spoke about on the last slide that was up, whether that's for professionals or whether that's for families and young people.
I think we meant for that person for both.
Okay.
Yeah.
Okay.
Candice, do you want to come in?
Perhaps we'll push on then.
Should we just though, because we're going very rapidly, just give some context, I think. So what we were commissioned to provide recommendations for policy and practice about resetting care during and following COVID, but also to provide recommendations about what we should do in future emergencies. So the research that we've done covered quite a few work packages, and we started with a review of the international literature on the impacts of changes in services to disabled children during COVID. So we brought all that together in what's called a mapping review, which is hopefully going to be published soon, and there's information about it on the website for the study that I think you've been given a link to. Then we've also been working with 5 sites, and those sites are either bounded by a local authority or by an NHS trust. looking at the change that's occurred within that area and the impacts on children and young people and their families. So we've interviewed providers of services, commissioners of services, and the services are cross-sector. So we've talked to people from education, social care, health, and also third sector providers. And we've also talked to parent carers and young people about what happened, what worked, what didn't, what should we do going forward. And now we've brought all the information together to come up with these draft recommendations that we're putting to you today. We are only talking today about what should happen in future emergencies. We're not talking about what should happen going forward as we reset services, particularly in the NHS. So a lot of the information or a lot of the interviews were really covering the messages that were coming from government, how difficult it was to keep up, how we had different messages coming from different departments, and then that filtered down into different messages coming from different providers and different decisions taken by different providers about what they should do in terms of delivering services to disabled children. So that's where we've got to so far in terms of the guidance and the commissioning during emergencies. Chris, if you go on to the next slide, I think we come to the delivery, and some of these do, as you say, cover communication during emergencies and how we need to make sure that we've got a consistent message, which is partly about the guidance, but it's about and then also how we deliver care. So our next set of recommendations are covering service delivery. The first one is face-to-face contacts using PPE where necessary should be maintained for agreed problems at home or in a designated setting. Telehealth, which includes phone and video consultation, should be used where possible and appropriate. Families of disabled children should be supported to manage telehealth safely and confidentially, and local budgets should be used to enable digital connectivity for families of disabled children and young people. They make sense to you? Oops. Yep. Yep. Next ones then. Communication. So a local communication system should be established to enable families of disabled children to seek advice from professionals during an emergency. Statutory services should engage with community leaders and third sector organisations to ensure communication of information for families about service access. And families should receive a phone call or other message to inform them about service access, and the method of this communication and the message should be co-produced with families. Great. Cross-sector care. So what we're suggesting here is that services, cross-sector services should adopt an every contact counts approach where contacts with families are followed up with multi-sector reporting where necessary. And transdisciplinary care should be adopted where possible. The service addressing the highest need of each disabled child should lead the delivery of care and provide regular eyes on the child. And data should be shared between sectors and services using the child's best interests justification. And there should be multi-agency, either virtual or in-person meetings across services and sectors to share relevant information. Yep. Thank you. And then if we're moving on now to identification and referral of families, Louise, this came from, I know that you raised the question of new families, and the prioritisation really was in some cases the needs of existing families that services knew about. What we were hearing is that children were referred to specialist services perhaps unnecessarily, and that the problems with lack of socialisation during COVID and lack of by children and also by parents and chatting about what was usual in terms of child development led to massive increase in referrals and waiting lists. So what we suggest here is there should be training for universal service providers to identify concerns and red flags across sectors. And we should ensure knowledge about any reduced emergency local offer and how this is met. Universal providers should triage the needs of new families, and a designated setting should be maintained for high priority in-person consultation. Okay, thank you. And supporting parent carers during emergencies. Accessible online support for parent carers of disabled children should be prioritised. Third sector resources and helplines such as contact listening ear service should be identified and publicised in local information for families. And parent carers of disabled children should be a priority group for psychological support and interventions required in an emergency. So, for example, in the current emergency, the provision of vaccines early to parent carers of disabled children. That's it. Those are our 29 recommendations for future emergencies. We've whizzed through them really, really quickly. Is there anything that you want to say about them or go back to any particular slide? Joanne?
So for me, there's the number 28 about the priority for parent and carers, for example, with the vaccines. That was something that I can recall we had issues with locally because of the different communication that came down from nationally and locally about who was eligible, and the fact that some of our vaccine sites were run by a national team and some of our vaccine sites were run locally. And actually, I think the message for me would be about that the communication that comes down centrally and the directive that comes down centrally needs to match what's being given out locally rather than them being two different things.
Yep.
That's a fair comment. The implementation of the policy is a sort of the next getting the recommendations right and then being able to implement them as two separate things. So quite take that on board, Jo. So I mean, it's been a really strong thread through our research has been how bereft many parent carers were during parts of the pandemic and maybe still are. So we wanted to make some pretty strong recommendations that would support them better in a future emergency.
Yeah. And the recommendation about the accessible online support, we know that online support did work for some parent carers of disabled children, but not all. And we're not saying that it works for everyone, but what we're recommending is that it is made available for those that it might help.
Yeah, so you've got that mix and match approach depending on need, haven't you? Which is,
yeah,
I think what we're finding now is needs to happen. Yeah, I mean, they seem totally appropriate recommendations from having lived through it all, and they seem sensible things to say. I think there are a lot of the questions were things that we had to face and probably didn't quite get right at the time because we didn't have that sort of any support about how to manage apart from just local people getting on and doing what they felt was the right thing. So. Yeah, they seem sensible. What happens to them now? Do you present them to a national body, or?
Well, what we're going to do next is a national consensus survey, where we want to reach as many people as possible who have a stake in the provision of care for disabled children and the commissioning of the care, the management of the care, and also the receipt of the care. So we are running a Delphi survey. So on the last slide, there's a link to the website where you can sign up for taking part in the Delphi survey. We're currently running a bit of an advertisement campaign of how to sign up. We really want really broad representation of all the key stakeholders, but also deep representation. So we want lots of people from the same group to take part, and all the groups who are involved with disabled children and their families to take part as well. So if you could share that link, that would be really, really helpful. If you could share it across your networks, within your settings and outside your settings, if you have national networks, for example, that would be really, really helpful. We're doing quite well with parent carers. We're doing less well with professionals at the moment. We've got good sign up from physios, for example, but our adverts are going out at different times in different networks. So there might be other professional groups that we have an uptick in, but if you could share it really widely, that'd be really, really helpful. So we're going to do that to get to the consensus on the recommendations. There might be some that drop out of the list because we don't get consensus, but we're hoping that it would be broad in scope as we presented today, so coming from the guidance down to the actual receipt of care. And once we've got those, then we are going to put them to local commissioners and managers, but also national commissioners and policy makers. So people at the NHS, people at the DFE, for example, to say this is what people are really wanting and needing. How are we going to do it? So how are we going to implement this? And we're also meeting with the professional bodies. So, for example, we're meeting with each of the allied health professional bodies, the RCPCH, and to make sure that our recommendations fit with theirs and that we can have a joint approach to actually pushing these out and getting agreement from the government department.
Yeah, I put the link in the chat. So if you click on it now, and also if there's an organisation you think we should contact, for instance, Commissioners Group, Joan, if you we can do the legwork happily if we know who to contact. So, those of you that haven't had a chance to comment, Pippa or Gay, feel free to come in on audio without the video if you prefer.
Hi, so my name's Gay Birtles. I'm the Special Educational Needs Team Manager in Wakefield. So I've just transferred from Sheffield, so I was involved with the DCO and Pippa Lord regarding health and commissioning and such, for particularly around cases tribunal.
Gay, are these making sense to you? Are they things that maybe some of you implemented already?
Yeah, a little bit is making sense. I've only been in the team 3 weeks, so so
that's new.
But I can reflect it back to when I were in Sheffield, and yeah, so yeah, it's to be absorbed and taken in and put into practice moving forward.
Thanks. Anybody else want to come in? I mean, just to say, when we set up the research, we envisaged that our recommendations would be about what to start if it wasn't happening already, what to continue if it was working well, and what to stop. And most of them are either start or continue. They're not about stop, but I suppose if you're doing something that doesn't fit with one of the recommendations that as everybody has agreed, then maybe, you know, if it is in opposition to it, then it would be something to stop. But we haven't got any stop recommendations.
Oh, thanks, Pippa. I've just seen your note, and I think it's quite reassuring. As when we presented earlier iterations of these recommendations, we've had far more coming, but it's really had quite a lot of input in generating them and then revising them sequentially. That actually is probably quite reassuring now that that we've got to a stage where they're really not generating quite as much.
Yeah.
Like, oh,
Yeah.
So I'm quite reassured by that. Yeah, thanks, Louise. The same. So, and it feels that reading them out now.
You've probably honed them right down, and you've had all the the sort of.
They've definitely been distilled. So
so
before we have run this workshop today, when I was talking about pulling the recommendations together from the evidence that we've gathered, we did have a long list, and we put that long list of recommendations to commissioners and providers and parent carers in a series of workshops that finished a couple of weeks ago. So we've had their feedback, as Chris said, on that long list of recommendations. There seemed to be quite a lot of duplication in terms of, for example, you know, we need to maintain face-to-face consultation for an agreed set of difficulties, for an agreed set of children and families, but otherwise we should be providing telehealth, and that came out in lots of different areas. So we've condensed that, and we've tried to cut the repetition down as much as possible, so we get to as short a list as possible, and then they're implementable, hopefully.
Yeah, that's really important, isn't it? It's got to feel like it's possible to do. Otherwise, people will just not engage. You know, find it really hard to engage. And they sound reasonable from my experience, and it sounds like other people here as well from their particular experience of the last few years. That sounds possible.
Yeah,
so
and
I think just having a plan, isn't it? Having a plan of how we're going to work in our local areas. Should it happen again?
And what we didn't want to do was stipulate who, for example, should receive face-to-face contact. That's for local teams to decide, because what might work for one area doesn't work for another. So there's local implementation and decisions to be made, but what we've heard really strongly is that needs to be across sector, and it needs to be implementable, and it needs to be communicated really clearly to families what this reduced offer is, and what they can expect and how to get it.
We also at various times have sort of thought about what the emergency situations might be. So obviously we've been through a respiratory virus pandemic, but in terms of planning, you have to be mindful of any global health emergency, climate change, economic emergency, all three happening at once in 3 months' time. So you know, we've inevitably drawn on the experiences of the pandemic, but the recommendations are written mindful that there are other emergencies, war could before, and we might need to generalize from the experiences that we've gone through and the strategies that we've had to think about to do better in future. So I think that comes through as well. Yeah, I'm not wishing to ski, but it's that's what this project is about, is doing better next time, and to generate that sort of mindset. In the survey itself, it's really going to be relatively quick, because if everyone thinks that they're sensible things to do, in the survey it's just going to provide each recommendation and the opportunity to rate how important it is, from not at all to critical, and so it really will only be a few minutes to complete, and then we look at that, whether there's agreement within parent carers and professionals, let's say, and then whether there's agreement across different groups. And then if necessary, we do a second stage, but if everyone agrees in the first round, that's it. But that's so important for us, because that's the external validity of our recommendations. There's an internal validity through the process that we've gone through to produce them, but then we do require that external rating to be sure that to have evidence of what we've done is credible to others. So encourage you to take part.
How much longer do you think it's do you propose it's going to take, or have you got any time frames on?
Yeah,
the end?
Yeah, no, well, the end of the tunnel is in sight. So the Delphi survey is going to happen in the next month. So really imminently. So people that register on the website will be sent a link to the survey. It won't be, so you need to get registered on the website to receive the link, and then that will be done, hopefully in October, beginning of November, and then we're into the final stages. So the researchers it never really ends, because then we suggest that further research is necessary, and then we have to write an academic paper about it and other things. And so torture never stops. But the actual substance of the work and the recommendations that we'll be passing back to the Policy Research Programme, that happens relatively quickly, and we hope that will have a big impact.
Yeah. Are there particular networks that you think that we should use to contact people about the survey? Hopefully it'll go out through the DCO, DMO, DISCO forums from CDC.
CDC have the best forums. They also have a commissioner forum, I think, don't they too?
Do.
So their forum platform would certainly touch a lot of people, I think, who would be interested.
Yeah.
What about the is it the directors of children's services in different areas? They have forum, I think, don't they?
Oh, do they?
Yeah. Certainly there is in the northeast, Lindsay. I can get you a link, I think. I'm sure I got a newsletter just this week from them, so that might be another place to go. So,
Thank you.
I think they're called Assistant Directors of Children's Services, something like that.
Thank you.
You said you were pretty good on Parent Care Forum, didn't you? So you've got that one.
Yeah, they've been quite active, and we've got the last time we checked last week, we had 160 parent carers sign up. Obviously we'd want more than that. We want more than that, but we're doing quite well with them. But if there are networks locally outside the network of parent carer forums, that then we'd use them too.
I guess if you use the forums of the commissioners and the DCOs and people like that, then they will probably be able to send on to their local groups. Yeah.
Well, hopefully you'll receive the link in the information from the forums from CDC. And
well done, Chris. You found it.
You found it.
I'm a researcher,
Yeah, very quick.
we just Google things. It's great.
Super.
Yeah. Carling is typing. Is that coming through to us? Nope.
Yeah, that's just a short evaluation of the day. If people could complete that, that'd be really helpful for CDC for future events.
Great.
Well, we're into the last minute or so. Is there anything anyone else would like to to say or share? Grateful to you, Garling, for hosting us.
Yeah, absolutely. Thank you.
Thank you.
Otherwise,
It was interesting. It was interesting to hear, and I'll keep an eye out for how it progresses on, because it was interesting. Thanks.
Yeah,
Joanne,
please do join the survey.
Whereabouts in Devon are you, Joan? Yeah.
I'm in Torquay at the moment.
Okay. And is that so? You're working across?
Yeah, working across the county of Devon.
Yeah. Very good. All right.
Okay,
well,
then.
nice to meet you all. And
Thank you.